work in healthcare, and so you're part of a big system, one that serves the young, the old, the healthy, and the not so healthy. Healthcare works 24 hours a day, 365 days a year. Serving over 1 million people, VCH is one of the biggest healthcare providers in Canada. Our scenic coastal environment is both urban and rural, and we serve communities that are 2 boat rides apart. Each day at VCH, we see 1,000 patients in our emergency departments, do over 300 surgeries, and make almost 900 home care nursing visits, and we all want to do the best job we can. To be the best at what you do, you need to have a clear direction. But how do we set a clear direction for such a large and complex team? Just as explorers use the North Star to show them the way, VCH is using the True North goals to point us in the right direction. The True North goals point our way to putting people first in our quest to provide the best possible healthcare and service. The VCH True North is made up of 4 distinct goals, identified by our leaders, staff, and partners, and endorsed by our board and our senior executive team. Promote better health for our communities. A lot of what we do at VCH is help those who are already sick or injured, or who need ongoing care and support. But we also work upstream to do what we can to prevent disease and injury. One example of this is immunization. Another is helping people improve things that affect their health, like food, housing, and lifestyle. Better health also means working better together so that services link with one another and are part of a system that includes primary, community, home, and acute-based care. Innovate for sustainability. History is full of healthcare innovations, from the invention of the first wheel, to Dr. Banting's discovery of insulin, to robotic surgery. Okay, the wheel wasn't a healthcare innovation, but it comes in handy, doesn't it? BC's first specialized hip and knee surgery center and our world-class research institute are just 2 examples of innovations at VCH. But innovation only works if it's sustainable. So, we innovate for improved efficiency as well as better health outcomes. Sustainable innovation is about ideas and hard work, and those things come from you. From surgeon to secretary, nurse to neurologist, there's a place in your department and in your daily work for doing things better. Develop the best workforce. Healthcare is a large and complex system, and it's people like you who keep the wheels of the system moving. Building the best workforce means building an engaged workforce, and that's something we all do together. It means feeling respected and recognized for the work you do. It means specialty training, growing in your career, having a voice in planning, and creating a safe and healthy workplace. People feel most engaged and do their best work when they know the goals of their organization and how they fit in. Altogether, this means more satisfying employment for you and better care for patients. Provide the best care. This goal is at the heart of our True North goals. Everything we do leads here. Maybe you see clients and patients all the time, or maybe you don't provide direct care in your job. Maybe you teach, or troubleshoot, or repair, or organize. Maybe you budget or plan. Whatever you do, it all makes a difference in providing the best care. When people receive care, they don't see everything that happens behind the scenes to make sure they get the best care. But when you think about what your department or program is doing, you can see the link to providing the best care. And in your own personal work, no matter what it is, you're working to achieve this goal. The element that holds it all together is people. The True North goals are about people like you, your colleagues, your patients, their families, and your community. We all have experience and knowledge that can help chart the course for VCH, for communities of care, for programs and services, and for each one of us. At VCH, we involve our patients and the public in shaping our healthcare system. When we say people first, it means we all have a voice in providing the best care. True North goals all fit together and point in the same direction. No matter where you are or what you do at VCH, you can use the True North goals to see where you're headed and why. Think about what the True North goals mean to you and the work you do. Are you and your team moving in the right direction? How are you contributing? What else can you do? Whether you're a member of a crew on a big ship or a small one, you have experience and knowledge that can help chart the course for VCH, for your community of care, for your program or service, and for yourself. Our ship has set sail and the journey continues. We'll have some smooth sailing and we'll navigate some rough seas, but every day we will use the True North goals to keep us on course. Using the True North goals, we can work together to keep focused on meeting the healthcare needs of our communities for this generation and their children and their children's children. And after all, isn't caring and putting people first what healthcare is really all about?